Health equity is important to the National Cancer Institute because the research that we lead, support, and conduct is really designed to inform strategies to reduce the incidence of mortality due to cancer in our population. To the degree that some populations have disproportionate burden because that evidence isn't reaching them either through policy or clinical practice, we want to make sure that we're providing the right evidence through the best research to reduce those disparities. Well, as NIH's largest institute, we have a special responsibility to address issues of health inequity. And we do this through applications of research, but also through the utilization of our extensive research infrastructure, 70 NCI designated cancer centers, a major national clinical trials program, a breadth of epidemiological cohorts and intervention studies. And by bringing all of these resources and tools to bear, we feel we can make significant progress on reducing health inequities by the generation of new evidence, but also by implementing the best evidence we currently have available. So in the area of cancer control, we have incredible opportunities to significantly reduce the burden of cancer in underserved communities. And there are some really compelling examples of this. Cervical cancer is a great example. There are significant disparities in cervical cancer incidence and mortality, but now we have a cancer prevention vaccine, the HPV vaccine. If we can get people vaccinated, we can prevent cervical cancer. Similarly, in colorectal cancer, we know that we have the tools, again, the screening modalities that can allow us to detect colorectal cancer early, but also to prevent the progression of colorectal cancer. That's really essential because what it means is that if we can improve the delivery and uptake of these preventive services, we know we can have a significant impact on reducing cancer mortality. We can make tremendous progress in reducing the most common cancers, the most common causes of cancer death, by focusing on strategies that address the biggest risk factors, the biggest drivers of cancer in America. That includes tobacco use, which still accounts for 1/3 of all cancer deaths in the United States. That includes colorectal cancer, where we have effective screening strategies. And that also applies to cancers like cervical cancer, where we have an effective cancer prevention vaccine. By employing the best evidence, by conducting additional research and developing more effective strategies, we can have a significant impact on reducing health inequity in the United States.